Back in April 2019, I was approached by our Director of Finance at the time with a small pot of funds to do a 3-month pilot in the Berwick area to add a resource. Berwick's a really difficult to reach area, especially when our resources go to the acute hospitals. Our local acute hospital is 60 miles away, so they're out the area for quite a considerable amount of time, which obviously leaves a bit of a gap for us to resource. One of the other objectives was to work with primary care and build up relationships with primary care, but also within the minor injuries unit within the town. Prior to the community paramedic being put in place, our response times for a C1, which is our life-threatening emergencies, was sitting around 12 minutes. We're now down to 6 minutes. That's really positive for all of the patients in the area. They do all of the home visits for the GPs, the 2 GPs practices within Berwick upon Tweed, which frees up the GPs to see more patients in-house and, for paperwork and that sort of thing. So that's a great big benefit for the community. And working within the minor injuries units, it's sort of building relations between Northumbria and ourselves, because prior to that, perhaps paramedics didn't know just how much they could do within the unit, but equally the staff in the unit maybe didn't know as much about what a paramedic's role is and the skills that we can bring. So it's been really, really positive for everybody.
The benefit of working in the community paramedic scheme as opposed to working on as a paramedic in a double crewed ambulance is the benefit to the patients. So we carry an extra range of drugs such as antibiotics and painkillers. So we can treat people out of hours, for example, when the GP surgery is shut. For chest infections, UTIs, we carry extra analgesia, and in given that, we can leave the patient at home. Whereas previous to that, if I was working as a paramedic on a double crewed ambulance, that patient would probably have to go to hospital. I love the continuity. I like going back to see how patients getting on. Previously, when you take patients to hospital, you leave them at the door, you leave them with the doctor or the nurse, and you never see that patient again. But this scheme allows you to follow them up through the GP and to manage the patients better.
This job appeals to me because it allows us the opportunity to work within 3 different domains. So we work for primary care, we help out in secondary care, and of course continue responding in emergency care. We do the GP visits in the area, so it means that we can go and assess the patients on behalf of the GP. Also, within this area, there's always an emergency response, and we are ring-fenced to the TD15 area, so there is always someone to respond to C1s and C2s if the crews are away somewhere else.
A paramedic is ideal for this role because we're used to dealing with the emergency situation, so we're used to quickly deciding if somebody needs emergency care or if they can be dealt with within the community or referred on to another team. So we're able to take that clinical decision quickly whether they need that emergency care, and we can also take our time and do further investigations, liaise with our other clinical assistants, and we can arrange further care if that is required. By enabling us to treat people closer to home, it means that we're reducing the amount of transfers to NSEC and to other hospitals. So we're reducing that impact on the wider NHS, because if people don't need secondary care in hospitals or appointments with other services, if we can deliver that care within the community, then we're reducing that impact and reducing that ripple effect throughout the NHS.
My dad's really quite complex. He's got so many health conditions that have the domino effect. So we relied on needing support to find ourselves with very little during lockdown, which obviously everybody was in the same situation. But we found that having the community paramedics, when they first started visiting, it was quite novel. And they came out and they were really good, and over the course of time, due to Dad's health, we've had them visit so many times, so many times. But we've been able to build up a relationship with all 3, Paul, Julianne, Wayne.
3 of them are absolutely brilliant. and I can't praise them high enough. They're not.
I'm thrilled that we've been made permanent. It's the result of a lot of hard work, 2.5 years of hard work. The population of Berwick and the clinicians in Berwick have really appreciated that we enjoy providing that care as well. So I'm absolutely over the moon that we've been made permanent.